Saseni mkofiti manze nimewahata sana. Welcome to Cele's Reflection. Welcome to a new month of October. This is the first Wednesday of October. Na kama mnajua, October is the Breast Cancer Awareness Month. So lazima tu Cele tuchanuane. Hata mimi nichanuke by the way. Juu kuna vitu hatujui. Personally sijui kila kitu. I don't know about you. So being the Breast Cancer Awareness Month, I thought it would be a good idea. We have Dr. Monda again, our gyna. Arudi tena. Tumulize one or two questions about sana our body, women as women. So last week, I had a discussion with a good friend of mine, a few weeks ago, not last week. Then nikauliza maswali pale Instagram. Nikauliza wase, especially as women, what is it that you always want to know about your body? Tumesikia breast cancer, there's a way you're supposed to feel a lump, you're supposed to do this and that, but hatuna information yote. We just have bits and bits of, oh, there's breast cancer, oh, it can shika you at any age, oh, there's cervical cancer, oh, cancer kills. We have bits and bits of information. So nikasema, why not invite Dr. Monda? And I am so happy she came. She's here. Akuje atufunze, at least hii information isikue nusu. We have the entire information from the specialist, not from Celestine. I am here to learn with you, Leo. So karibu sana Dr. Monda.
Thank you, sir.
Yeah, and because of Breast Cancer Awareness Month, tukasema daktari, can you come back to our show? Daktari was so willing to come back to our show, at least to teach us something.
Yes.
Yes, and I'm happy that you're here. At least tusaidike mimi na mama wenzangu, ama my sisters, my aunties, our parents, our fellow women.
Yes, it's good for us to give information so that you're able to make informed choices about your health. Yeah, and fill the gaps that there seem to be.
Yes. Which
there are quite a number actually.
Me, I just know of one thing about... Don't laugh. I am sure we are many. I am sure I am not alone. Najua, there's a way I am supposed to feel. I am supposed to feel a lump. I don't know whether it's in either, ama it's in both. But sometimes I feel a lump. There's something. It's not just like that. There's something. But sijui sasa lump gani ndo inafaa inifanye? Niende hospitali.
Yes. Now, the idea of what we call a breast self-examination is for you to actually learn what your breasts feel like. Ideally, you should do it in front of the mirror once a month after your period. Because during your period, your breasts tend to be very tender and they also tend to be lumpy. So when you do a breast examination during that time, you may actually panic and think that you do have a lump when you don't. So the best way to do it is you stand in front of the mirror and, yes, and then you feel in a circular motion around the breast.
My periods.
Not during your periods, after. Okay, so you do both sides, on one side and on the other side. Ideally, you should do it after your period in front of the mirror once a month. And then you then go and have a clinical breast examination done by your gynecologist or by your doctor at least once a year. Before we now start talking about screening, sending you for ultrasounds and mammograms.
Am I supposed to start doing this immediately after I get breast? At what age?
When you develop breast, really, from the age of about 20. From the age of about 20.
So from the age of 20, I am 29, guys. Every month I should have been checking.
Yeah, you use the palm of your hand, okay? And yes. And then you do it, by the way, standing in front of the mirror and also lying down. Because sometimes a lump, you may not be able to feel a lump when you're standing up, but when you lie down, because the breast tissue then flattens out, you're able to pick a lump.
But there's a lump. Is there something? Am I supposed to feel anything?
No. If there's a lump, then you go and you see your doctor.
Doctor,
you understand?
You're scaring me.
No. Celeste, let me tell you something. When you do this once a month, you learn the texture of your breast. And you'll be able to pick out when there is a problem, even just an area of tenderness, pain. Then you go and you see your doctor. So that's the idea. You learn the texture, you learn the consistency, the texture of your breast. So that when there is a lump, you will be able to pick it up and then you go and see your doctor. And then remember, I've also said that you're ideally supposed to go and have a clinical breast examination done by your doctor at least once a year.
Daktari, I haven't done any of those.
So you need to start, Celeste.
And I am 29. Unajua unanishtua aki.
You need to start, yeah.
So, tumelipa consultation daktari, maybe tunaweza angalia na hii yangu tuone kama
Sure.
tuone kama
What you do now, ideally,
ukipata don't tell me.
No, I won't tell you anything, don't worry.
I'm not ready.
Ideally, you put your hand up straight like this in front of a mirror, and then you go round using the palm of your
hand.
the flat surface of your fingers, okay? And then you just go round. Okay. Now the commonest area for you to find lumps is actually here, in the upper outer quarter of the breast.
Am I supposed to press hard?
No. You'll be able to tell.
Oh.
And you do it in the bathroom because you see, then your skin is wet and it's easier to feel something. So you do it on both sides.
So see ati nafinya sana. It's like I'm looking for it. It's like I want it to be there.
It's actually for you to learn what your breasts feel like. I'm not in the right position to actually do this for you.
I'll come and see you.
Yeah. Okay.
I will come.
Yeah.
So both of them?
Yes, both of them. And then you check to see if there's a discharge from the nipple. Because if there's a discharge from the nipple, if you're not breastfeeding, there is a problem.
True.
Okay.
Yeah.
So you do that once a month, standing in front of the mirror and lying down.
Every time after my period?
After your period.
Not during my
Not during your period. Because during your period, your breasts are lumpy and tender. They're painful. So it can be very uncomfortable. And then they're lumpy also. So you may think you have a problem when you actually don't.
Then you start panicking.
Yes. So once you go and see your doctor, they will do a clinical, what I have done. We'll do a clinical breast examination. And then if we feel it's necessary, then we send you for a breast ultrasound. Usually from about the age of 25 to 35, we'll send you for a breast ultrasound. And then from the age of 35, we can do either an ultrasound or a mammogram, depending on what we feel we need to look for, if at all there is a problem. Then from the age of 40 to 55, you do mammograms every year until the age of 45. Between the ages of 40 to 55. Then between the ages of 55 to 75, you do it every 2 years. After the age of 75, you can decide whether you want to continue having them done or not.
But at least right now, from 20 to 35, just keep on checking.
Keep on checking, do your monthly breast self-examination because it's your own examination, and then make sure you see your doctor at least once a year to do a clinical breast examination. Then they'll refer you for the test that is required, the screening test. We actually do it as a routine. Okay, so from the age of 40, we do mammograms as a routine once a year.
What is mammogram?
A mammogram is it's an X-ray of the breast. So, cancer cells tend to, because of their characteristics, they tend to deposit minerals. So they appear as white. It's a special kind of X-ray. So they appear as white round objects on a mammogram. So that is why we do them between the ages of 40 to 55. Now, another reason we do mammograms more often during that period of time, that's the commonest time for you to actually develop cancer of the breast. Because cancer of the breast tends to be a disease of the older woman. But it does not mean that it cannot happen in a younger woman. And unfortunately, when it does, it's actually more aggressive. So that is why we have to regularly check our breasts ourselves, at least have a breast examination done by a doctor once a year. And then they will send you for the required test, depending on your age and what they feel needs to be done after that.
So that means this month we're only taking care of breast cancer?
No. There are very many different cancers that women can suffer from, okay? So breast cancer is one of the one of the cancers that women suffer from, and then cancer of the cervix, of course. Cancer of the cervix is a leading cause of death due to cancer in this part of the world. Yeah, and it's caused by the human papilloma virus, which is a sexually transmitted infection, and it's the commonest sexually transmitted infection in young men and women of reproductive age below the age of 30.
Whew, again,
and it's very infectious. In fact, you just need skin-to-skin contact. You don't have to have penetrative sex to pick up HPV. So the good thing is, in 90% of us who pick up the infection, our immune systems clear it naturally. But it's in the remaining 10% who have persistent HPV infection that will eventually develop abnormal cells, which will eventually develop into cancer of the cervix. And the commonest strains of what we call HPV, in short, the human papilloma virus, the commonest strains that cause cancer of the cervix are type 16 and type 18.
What are those?
It's a virus. It's a virus. It's a virus.
Okay.
It's a virus called the human papilloma virus. And the one we need to worry about are type 16, HPV 16 and HPV 18, because those are the ones that cause the abnormal changes in the cells in the cervix that will eventually develop into cancer of the cervix. Now, the reason we encourage women to have pap smears done on a very regular basis is cancer of the cervix is a very slow-growing cancer. So from the time you pick up the HPV infection to the time you actually develop frank cancer, it's about 10 to 15 years.
So from the time you start having sex, you're supposed to start going for your
regular pap smears, yes. So from the time, let's say you start having intercourse from the time of the age of 21, the first, you do a pap smear once a year for the first 2 years. If they're okay, meaning they're negative for cancer, then you can do your pap smears every 2 to 3 years. Every 2 to 3 years.
I have never, this month of October now, I'm going to have it done. Yeah, I'm going to have it done because, well, it's never too late.
Yeah, it's never too late. And you know, the sad thing about cancer of the cervix is in the early stages, there are no symptoms. By the time a woman is developing symptoms of cancer of the cervix, that disease has grown and it has spread. Because you'll find she's having an abnormal vaginal discharge. It's usually smelly, it's usually bloody. She'll have pain when she passes intercourse. And by the time now we're doing a pap smear, we actually are examining. Many times we put in a speculum, this gadget. We put in a speculum and you find that the lady actually has cancer of the cervix because you actually see a mass.
Is this process painful?
No, it is not. It's a 5-minute test that we do in our clinics.
The name sounds so serious. Pap smear.
It's much longer, my dear. Yeah, it's a much longer name, so we've just shortened it. So what is involved is actually, unfortunately, I didn't bring the uterine modeler. This is what we call a speculum. Okay, and there are some metallic ones, and there are also some, you know, the plastic disposable ones. So what we do, this is the only bit that goes into the vagina, okay? Because you're able to reach the cervix through the vagina, yeah? So we put a gel, you lie down, you put a gel, and then you insert this into the mouth of the vagina, okay? Like that. And then you open up to be able to get to the cervix. And then I use this brush to roll in the mouth of the cervix. You just roll it about 5 times because it picks up cells. It's painless. It's like brushing the inside of your mouth. And then we take whatever we have picked and put it on this slide. Just like that. And then we fix it with this. This is alcohol, a special kind of alcohol. Then we pour it on the, whatever it is we have put on the slide, allow it to dry and send it to the lab. So in the lab now, the pathologist is able to look under a microscope and tell us whether there are no cancer cells, and if there are cancer cells, they'll tell us what kind of cells that they see that will then tell us whether or not we need to worry. So if it is very early cancer, if it is frank cancer. So and there's a way we grade those pap. Yeah, there's a way we grade those pap smears. It's a very simple thing. Within 5-10 minutes, you're done.
Yeah, it's very.
And
it
it's
looks
painless.
very simple.
It's painless. Yeah. Remember, a baby's head is supposed to pass through the vagina. Yeah. So you can imagine. I mean, it's only this bit that's going in, and it's lubricated. Yeah.
It looked very tough at first. I was like,
no, it isn't.
No.
It isn't.
And it will save you a lot.
It's
like once
it saves
you know,
lives.
the earlier you know.
Yeah, it saves
also,
lives.
they're telling me, someone told me, what you don't know won't kill you.
The problem is, if ignorance is not bliss, my dear, because it's that ignorance that will kill you.
True. Yeah. Too late.
Too late.
Can't realize when it's too late.
When it's too late.
The earlier you know, the better.
The better.
Is it curable?
Yes. Cancer of the cervix is 100% curable, caught in its early stages. Imagine, all you need to do, Celeste, is, for example, that's the cervix. If we pick up abnormal cells, all we do, it's a special kind of thing. It's a simple surgical procedure. We just go and cut out the abnormal cells and send it to the lab. And the pathologist will tell us whether we have made sure that we have no cancer on the edges. And that's it. And the cervix is able to heal very quickly. Imagine, it's that simple. So when a woman dies of cancer of the cervix, it's actually very sad.
Because so that's why you're telling us to go and have these tests.
You need to have these tests done on a regular basis. But even cancer of the breast, caught in its early stages, it's curable. Yeah, because if it's just a matter of a lump and it has not spread, in fact, nowadays we don't have to remove the whole breast. Yeah, there's an assessment we do. The risk factors and all that, there's an assessment we do. So if it's just the lump, we're able to remove the lump and then send you for chemotherapy and radiotherapy, and you're good to go.
I think okay, our main
ignorance and
reason,
fear.
Also lack of information.
Yes.
You see, I didn't know it was that easy.
Yeah.
I knew it was a whole process. I'm going to be in the hospital a whole day.
No. It's a 5-minute thing.
I'm going to have it, doctor.
You need to.
I will. Like I am and now, I will. So now, since I'm 29, I'm supposed to have it every year. I'm after every once.
You see, you've never had one done before. So ideally, you should have one done every year for the next 2 years. And then after that, if you choose, you can have it done every 2 to 3 years. But a lot of women have just gotten into the habit of doing a regular pap smear. Like maybe on your birthday, gift yourself. Go and see your gynecologist, do your pap smear, have a clinical breast examination done, have either an ultrasound of your breast done, an ultrasound of the pelvis. Just have a basic medical checkup done. Because we're able to pick out, yes, that's self-care. Love yourself, gift yourself that, like on your birthday, once a year.
I'm here thinking, maybe birthday yangu nilikuwa nafikiria sijui nini. Kumbe there are better things to do. So I have a few questions.
Yeah, sure.
After thinking about it, I asked my people up on Instagram, and they sent me so many questions. I was like, wow, so we are so many. It's not like we just need to know.
You need to know, and there's a lot of misinformation out there. There's also Dr. Google, so you need to know. You actually need to get the right information from an expert or a specialist. Yeah.
So I have a few questions from the people.
Yeah.
There's someone who's saying I have been feeling a lot of pain, like kidogo pain on my left breast. Went for checkup, na haikuonesha anything. Is there a test that can be done? I think the test you're saying is the ultra, because she's saying she's feeling pain. Nika amegongwa. Sometimes she feels pain on her left breast.
Okay, now what we need to understand, the breasts are part of the reproductive system. So as your uterus is preparing for pregnancy, the breasts are preparing for breastfeeding. So that if you get pregnant, that process continues. If you don't get pregnant, that process subsides. So the breasts respond to the hormones just the way the uterus responds to hormones. So the most likely thing, what she needs to do is to check what time of her cycle does she get that pain. So she will find it is most likely around the time she ovulates and also around the time she's having her periods. That's one. Two, I don't know what tests she has had done. Has she gone and had at least a clinical breast examination done by a doctor? And if so, was she sent for an ultrasound? Okay. And if the ultrasound didn't show anything, the most likely thing is that her breasts are just responding to the hormonal changes in her body. It's something called cyclical mastalgia, pain that you get from your menstrual cycle. So what we usually do, if we find that there's nothing wrong, we've done scans and everything is good, what we usually do is just encourage you to wear a firm breast support in the form of a bra, and then just painkillers, and you're good to go.
So there's nothing to worry.
There's really nothing to worry about if she has seen her doctor and she has been told that actually there is nothing.
There's also someone who's saying she's had having a mass on my left breast. Went for a checkup, they said itaisha, but haijawahi isha. I don't know what mass nika yo lump.
That's a lump.
Yeah. Wakasema itaisha.
She needs to see somebody.
Maybe a follow-up.
She needs a follow-up. Because was a scan done?
I don't know. But
see, those are the questions I now then ask. Who did she see? Was a clinical breast examination done? Was she sent for an ultrasound? And what did the ultrasound show? Was it something that was something that is an infection? And if it is a lump, she needs to actually have that looked at. She can't just ignore it.
Other than the feel touch method, do we have like physical signs and symptoms of breast cancer?
Breast cancer, yes. Breast cancer, interestingly, is the lump is painless initially. Okay, it's painless. It is firm. It's not smooth. Okay, and then because cancer grows and attaches onto the surrounding tissues, it's not mobile. It doesn't move. Yeah, and then the surface on top of the lump looks like an orange peel. It's called peau d'orange in French. It looks like it has an orange peel appearance, and then you will get a nipple discharge, usually bloody. Okay, usually bloody. But one would hope that a patient does not wait until they get to that point, because it means now the cancer has become invasive. That's one. Two, not all breast lumps are cancer. Okay? You'll find that young women of reproductive age tend to get lumps we call fibroadenomas or a breast mouse, because you find when you touch them, they actually move in the breast. Yeah? They move in the breast. They're usually, they're firm also, but they're round, they're smooth. And they tend to be a little tender, especially during your periods. So any breast lump, Anybody who feels anything actually needs to go and see their doctor, and then we'll send you for a scan, an ultrasound of the breast. If it's a fibroadenoma, we will still send you to a breast specialist to take a bit of that tissue to confirm whether it is cancerous or not. Okay. So there's a process to the whole thing. The most important message I want patients, your audience to get is that they need to get those lumps checked. Somebody cannot tell you itaisha. No. And they have not examined, they have not sent you for tests, at least even a basic ultrasound. And somebody has done a clinical breast examination as well.
True. So just if you feel like
anything
this
different
one is not normal,
go and see your doctor.
Yeah. There's someone who's saying her mother is at the age of 40 and she has extreme bleeding. 40s. Her mother now. She's asking about her. Well, I don't know if it's a cause of alarm. But
yes, it is.
I think it is.
Anything different from what is normal is definitely an indication that there is a problem. I can't tell her straight off the bat what could possibly be the problem. She could have a hormonal problem. She could have fibroids. She could be on a contraceptive method that is causing that abnormal bleeding. She needs to encourage her mother to actually go and see a gynecologist so that we actually find out the cause of that bleeding.
So is pap smear the same as vaginal checkup?
No, that's different.
This is for cancer?
This is a screening test for cancer of the cervix. But another thing is, Celeste, as we are doing a pap smear, I don't just put in that speculum because I'll examine the outside first. Because there are other things that there may be. You may have a growth, you may have a wart, you may have a fungal infection. And then is when you put in the speculum. And as you open, remember, I'm in the vagina. I look at the vaginal walls as well, because that could also have a problem. You may have an abnormal discharge, you may have warts, you may have a growth before we actually do the pap smear.
So during the process, we can come out with something.
There are other things that
not
you
even
look
the
for.
cancer.
It's not just the screening test that we do.
Because there's someone who I saw a question, I can't get it now, but they were asking about warts down there.
Genital warts. The human papilloma virus, the type 16 and 18 also have cousins. The commonest being type 6 and 11. HPV, the human papilloma virus type 6 and 11 are the ones that cause the genital warts. Okay? So that also is an STI. It's also a sexually transmitted infection. Yeah. So if she has genital warts, she needs to go and have her doctor have a look at them and put her on treatment. And that is somebody who also needs to have her pap smears done on a very regular basis. Because where there's 6 and 11, you may find 16 and 18 as well. Yeah. Another thing about the human papilloma virus, Celeste, before I forget, the preventive measures for cancer of the cervix, one of them is vaccination. We have a vaccine against the virus, against the human papilloma virus. They are available. The good thing is the government has actually rolled out vaccination against the human papilloma virus. We're giving it at the age of, in the public hospitals, they're giving it at the age of 10.
10, yeah.
But the ideal age, we always say the ideal age is between the ages of 9 to 16 before girls become sexually active or are exposed to the virus. But it does not mean that if you're older than that, you cannot benefit from the vaccine. It says that that's the ideal age. That's when it's most efficacious. So we have two brands in the market. There's Cervix, which covers type 16 and 18. And then there's Gardasil, which covers type 16, 18. And then the wart-causing viruses, type 6 and type 11. There's also another one that has an extra 2. It covers against another 2 viruses.
Wow, there's someone who said, I do my pap smear every June as my birthday gift.
Yes.
Wow, that is so good.
That's good.
I also have an idea now for next year's birthday.
Yeah.
I will be doing it every year. So there was someone who was asking, how should we deal with BV and yeast infection? Because more than 75% of women experience that.
Okay. Now,
okay, I don't know about the statistics. Ameandika too.
It's fine. Our bodies are not sterile. We have organisms that live naturally on the body, on the skin, in the mouth, in the large intestine, and for women in the vagina. Now, men don't have a vagina, so they don't have the issues we have. So in the vagina, we have it's a community of organisms as well, okay? Mainly fungi or fungus and bacteria. Now, they compete for oxygen and food, so they keep each other in check. And then the vagina itself is acidic. That acidic environment is created by some of that bacteria that lives in the vagina. It's called Dodelane's bacilli. It's the same bacteria that converts milk into maziwa mala and yogurt. So what they do, they create an acidic environment in the body by breaking down some sugar that we have in the vaginal cells into an acid. That acid now makes the vagina acidic. The acidity is nature's way of protecting the upper parts of the reproductive tract, like the uterus and the tubes. And then it also keeps these organisms below a certain level. But sometimes, depending on the time of your cycle and for whatever reason, that acidity may drop. And when that acidity becomes less acidic, these organisms can multiply and grow. And that is now when you get the yeast infection and bacterial vaginosis. It's actually an overgrowth of those organisms that live normally in the vagina. So the acidity may drop just before your period, just after your period, around ovulation time. It's almost standard during pregnancy. After sexual intercourse, because semen is alkaline, you mix an alkaline with an acid, the acid becomes less acidic. Women who douche, you're not supposed to wash inside the vagina. The outside, yes, in between the lips is okay, but not inside the vagina, because you disturb that balance. And then women who are HIV positive, who have anemia, who are diabetic, because those are diseases where your immune system is suppressed. And then even after a course of antibiotics, because those antibiotics clear out that good bacteria. And without that good bacteria, you don't have the acid being produced. Once that acidity stops being produced, then the vagina becomes less acidic, and then the candida can multiply and grow, that yeast. And then that forms now what people call yeast. That's when you hear women saying that they're allergic to antibiotics. That's actually what they're talking about. And then even just hot weather. If you have an overgrowth and you go, for example, to the coast, because of that warm, moist environment, it actually flares up and can even spread to the skin on the outside. Yeah. And then some women are allergic to condoms. Even that can cause it to, it can cause the organisms to actually multiply and grow. And then I've talked about antibiotics as well, isn't it?
I am nodding like this because now I'm relating. Now I'm getting questions.
Okay.
I'm getting answers.
You're getting
myself.
answers, yeah.
So I'm like,
we need to understand it's an overgrowth. It's not an infection. It's not from outside. And that is also one reason we don't treat your sexual partners, because there's nothing we're going to treat. They only carry the spores. So what you do, when you get that discharge, you go and see your doctor, because it may not necessarily be yeast. Self-treating, a lot of times you self-treat when there's a bigger problem. So you go see your doctor, we will examine, and if it's a yeast overgrowth or bacterial vaginosis, we treat you. If it becomes very recurrent, there's a way we treat so that, at least after every period, so that then we're able to clear the infection or the overgrowth. Wow. So it's not abnormal. It's not disease.
It's not a disease.
And it has nothing to do with cancer. Yeah. It's just the organisms that live normally in the vagina that have grown, overgrowth, because of the drop in the acidity in the vagina.
Unless it keeps on persisting. Unless it takes too long. So that's when you need to see a gyna.
You need to see a gyna.
Really after your periods. You're like,
it's very uncomfortable, Celeste. Remember?
No, there's the normal one. There's the one you're saying, maybe during your periods, it triggers because of the hormonal imbalance. So there's that one. But there's the one that you must feel 2 weeks, 3 weeks, no, I need to see a doctor.
Okay, let me explain something. You need to understand what a normal vaginal discharge is, and an abnormal vaginal discharge, okay? A normal vaginal discharge is usually like mucus, usually either white or yellow, like egg yolk. It may be a bit bloodstained. A lot of times, you'll get it in the middle of your cycle when you are ovulating. It has no smell and causes no itch. Okay? Yes. And then the vagina itself is also moist. It's not dry. So anything outside that, where there is a smell, where there's an itch, where there's excessive discharge, or where it's bloodstained, where it's a different color like green, you need to see your gynecologist.
That's clear.
Yeah.
Hadi hapo we are clear. Now there's a myth here. Someone was saying, if you're sexually active, you need to drink a lot of yogurt to kill infections. I don't know how true that is. Is that true?
No.
You've mentioned yogurt, so I'm like, wait, was this person right?
No. Remember the bacteria that is in our vagina, okay? That lives normally in the vagina. A similar type is what is used in these dairies to create yogurt.
Oh, okay.
Okay, and maziwa mala. So, drinking yogurt really, because how does the bacteria get from the yogurt into the vagina really? So it's just, it's the bacteria, it's usually from the surface of the skin. It's recolonized from the surface of the skin.
Okay.
Yeah.
And is the cervical cancer genetic? Like
No.
if your mother maybe had it?
No. Remember, cancer of the cervix is caused by a virus, a sexually transmitted virus.
Okay. Yeah.
Breast cancer is the one that is genetic.
Ah.
Yes. So the predisposing factors or the risk factors for cancer of the breast include age. It's more a disease of the older woman, okay? Your race and ethnicity. It is commoner in African and Caribbean women. And then if you start having your if you start having your period very early, if you have late menopause, if you have few children or don't have children at all, or if you start having children at a much later age, it increases your chances, of developing cancer. It increases your risk, let me put it that way. And then if you have a close relative like a mother, a sister, a daughter, who actually suffered from cancer of the breast, your risks of developing the disease are increased by almost 50%. And then there also, there's some genes in our body called it's a bit complicated, BRCA1 and BRCA2. Any changes in those genes will increase your risks of developing cancer of the breast. Remember Angelina Jolie? She actually went and had a double mastectomy done because her markers were very, very high. Her risks for developing cancer were very, very high. That is why she ended up doing that. And then women are on hormone replacement therapy. And then lifestyle issues like obesity. If you're obese, that fat tissue actually creates a high estrogen environment in your body, and it increases your risks of developing cancer of the breast. And then also a high fat diet, if you take a lot of alcohol, if you smoke cigarettes, if you've been exposed to radiation, those are the risk factors of cancer of the breast.
Yeah, but I'm glad we've been told if you check it every month after your periods, the earlier we know it,
the better.
It's curable. Yeah, so don't sit and say, my sister had it, so I'm going to wait to get it. No. The earlier you know, it's curable. So don't be shocked because your mom, some people will take that home.
Yeah.
My mom had it, so I'm going to have it. No,
not necessarily.
The earlier we get it, it's curable. So usishtuke sana.
It just increases your risks, that's it.
Nothing else?
Yeah.
Okay. In case you go for this, does it mean it can cause fertility problems, pap smear? Like, in case we have the cancerous cells, you've gone for the first pap smear, then there's something, and I was planning to have another baby.
No, you
can
can't.
Can it be?
You see, you catch it early. At that stage, you catch it early, and it's treatable. What we do is simply, in simple terms, we just remove the cancerous area. That's it.
And I continue.
Because remember, it's just in the cervix. Yeah, it's just in the cervix.
Okay.
So that is why it is important for you to have regular screening done, because this cancer takes a very long time to grow. And then it causes no symptoms in the early stages. So when you do a pap smear and we pick up these abnormal cells, we actually remove them surgically.
So you can still go on with my life. I can be pregnant.
Yes.
Doesn't mean that you can't.
No.
That's a good answer.
Yeah.
Because now I was about to do it next month and I'm like, wait, alafu niambiwe, alafu. Yeah. Okay. Paying attention. There's someone who said paying attention to how frequent you visit the loo. Ovarian cancer can be a cause on how many times you go to the loo. Is that a myth or it's a fact?
What happens? It's not so much the frequency as the type of stool you get. Okay, as a type of stool you get. Remember what I have said, gift yourself. It's not just a pap smear you're going for. You're having a clinical breast examination done as well. We can even send you for an ultrasound of the pelvis. That will tell us how your ovaries look like, okay? How your ovaries look like, if they're enlarged, if there's anything abnormal we may pick. There are also some tests that we can actually do, depending on your age and your risk factors.
Now, our problem is we only visit the gyna when we are pregnant. Ama when we feel, niko kashida cha niende kwa gyna. That's the only time.
You need to go and see your gynecologist or your doctor at least once a year for a checkup.
Meskia? Once a year, visit your gyna.
At least once a year.
Especially, ulisema after you're now sexually active.
Yes.
Just start seeing the gyna. Treat yourself. Self-care. Part of your self-care.
Celeste, I have to say something. Remember, if you're not sexually active, you still have your breasts, you still have your uterus, you still have your ovaries. So you still need to go and have your checks done. Because there are other organs that could develop cancer.
So, daktari amefunikia hiyo yangu. Yeah, so it's important to go and have those, especially this month. I think after this video, we need to start booking our appointments.
Yeah.
Come, me, I am ready now. I'm going to have it because let's not sit and wait.
Yeah. And you'll be surprised at how painless it is.
Yeah, I've seen it. Come,
It's
exactly how you
simple thing.
But it's not painful because there was a question of how painful is it.
It's not painful.
I think we also we have fear.
Yes.
So niende alafu nirudi hapo nikae siku 3 nikikunywa painkillers.
No. Nothing near that, by the way.
So the questions are many. The questions are many, but the way we've spoken about it, we've made it like it's easier now. In case you see something abnormal, feel free to see your gyna. But now I normally say mimi ni mama kijana. Okay. Now we've spoken about ladies' breast, cervical cancer. Boys, kwani wao sita wanagonjeka cancer?
Yes, that's true. We encourage men to check their testicles at least once a month. They also need, just the way women check their breasts, they also need to learn the character of, they need to check their testicles to be able to pick out if there's anything abnormal. And then from the age of 40, you need to start now being very prostate aware. The prostate gland, that's one of the commonest cancers that men suffer from. So you go and you have a prostate exam done, and there's a blood test we call a PSA that we do on a regular basis. Yeah, and if we find anything abnormal, then you're referred to a urologist.
That's the only leading, like,
the leading cause, yes.
On men?
Yes.
That's how on a breast.
Oh, no. By the way, no. Breast cancer does occur in men. In fact, it's a good thing you have asked. Breast cancer does occur in men, so they need to check their breasts as well.
The same way we do?
The same way we do.
But not monthly now?
No, just as regularly. Just as regularly. Once a month. It doesn't cost anything.
So for them, they touch, even when you
just the way we did it for
just do it. It's for your own good. So even you boys, during your birthday. But you're saying from the age of 40, so?
No. That's for the prostate. So for the breast, check your breasts regularly. You know, for them, they don't have the size of breast that women have. Yeah. So it'll be very easy to pick out something abnormal.
Earlier. So for them, not below 40, you can't get prostate cancer?
It's commoner. You see, just the way cancer of the breast is more common in the older woman, okay? But it does not mean it can't occur in the younger woman. It's the same thing for men. It's a disease more common in the older man, but it doesn't mean that it cannot happen to somebody younger, because there are those outliers, what we call outliers. Cancer of the testicle is more a disease of the younger man, but it does not mean it won't occur in an older man. Yeah.
Meskia, boy child, spendi kuacha nyuma. I have a son, so we talk about ladies, then we forget about the boy child. So I'm there pushing for my son.
The other common cancer, by the way, my dear, is colon cancer, and we do a very basic test. We test for blood in stool, so that can be done for both men and women.
Oh, and there's something you were saying. Oh, now I remember.
Cancer of the colon.
Yeah. So the questions were too many. Thank you guys for engaging, of course, for the questions. But maybe to wrap it all. Now, personally, sijui kama, even you, the viewers, personally, now we have a bit of, tukianza zilikuwa bits. Now we have information. Now we know what we need to check out for. Now we know, nikisikia hii iko hivi, enyewe hii si normal. Nikiona hii inakaa hivi, enyewe hii si normal. Now I need to see a doctor. And this being the month of breast cancer awareness, I think we need to take it upon ourselves and say, Celestine, naenda kufanya pap smear, the first one. And tell my sister, tell my mother, tell your friend, usifanye peke yako. Me, I'm happy because the earlier we know, the better. The earlier we know, the isifike mahali pa. It's
too late.
Too late, yeah. So thank you so much, Daktari. Maybe a parting shot to my viewers, kuna mtu for Daktari. So maybe you can tell them something.
We encourage, I'm encouraging, be breast aware, be health aware. Look after yourselves, love yourselves. Gift yourself at least a visit to the doctor once a year and have a thorough workup done, because it saves lives. It's sad when we come across a patient who has cancer of the cervix, for example, because that woman has either never had a pap smear or had just one. And if she had had her screening done on a regular basis, her life would have been saved.
And you're going to reduce the number of death rates because of cervical cancer.
Because of cervical cancer.
Yeah, because unfortunately, most of us, we are losing people because we didn't know. Now we know. Talk to them. Talk to your mom. Talk to your sister. It's not painful as I've seen. I'm yet to try, but it doesn't look painful.
It's not
It
painful.
doesn't look painful.
Yeah. And remember, prevention is better than cure.
True.
So we prevent by screening, using pap smears. We also prevent by vaccinating, and the vaccines are available. And then when you screen, we are able to pick the disease early, and we're able to treat early. So it means we are able to cure the disease, and that saves lives as well.
Yeah, so I am going to give you guys number ya daktari. Daktari, they can come to you?
Yes, they can.
Yeah, so na akikuja utawapea discount. Juu sasa tushafanya consultation.
Yes.
Now it's they are coming straight to the procedure. So daktari's number, maybe give them your details.
Sure. What you'll do, you'll just put them at, you link them.
Yeah.
The way you do at the bottom.
Yeah, the number, where.
Where, yes, exactly.
Yeah, then you can book an appointment with daktari. And once you've gone for the checkup, please, if you can, please, kuja tu peane comment, peane tu feedback.
Yeah.
Someone else will be encouraged. Unajua? Like tusaidiane tupunguze hizo death rates.
Yeah. And it's not a big process. I do the pap smear. I send it to the lab. Once I get the results, if it's cancer free, then I just send you a soft copy. So that way there's no back and forth. I make it very easy for my patients. So if they use your name, then I'll give them a discount.
Yeah.
We'll discuss the discount after this.
Daktari is calling me Celeste. So please go and say, you saw it on Celeste. Daktari amenipea jina mpya.
Oh my goodness.
It's a good name. Actually, people call me Celeste, Celestine. So when you see daktari, just say uliona kwa Cele's reflection, and prevention is better than cure. Venye daktari anasema, hii story ya kusema ati, what I don't know won't kill me. Please no. Please no. We need to stay.
What you don't know will kill you.
It will kill you very fast. So please, if you can, talk to your friends. October, tuangaliwe, treat your, kama ni gift, patia mama yako hiyo gift, pap smear, lipia sister yako. Let's do it. Let's not be ignorant, by the way. And that's it from me today. Enjoy your month.
Celeste, I'd like to say one last thing.
Okay. Yes.
We are in an era of COVID. COVID is here. It's real. And it kills.
True.
And we do not know who will get it and who will survive. So please, mask, social distance, sanitize, and please get vaccinated. Please make sure you get vaccinated. There's a lot of misinformation out there. I have been vaccinated. I am here. I have not grown horns. Nothing has happened to me.
I have also been vaccinated, and I brought them a doctor hapa hivi. Kwanza mimi nilikuwa frontline ya. No, I have been vaccinated. I have told my parents to get vaccinated. I have told everybody around me, get vaccinated. Ndio turudi, at least we go back to our normal life. At least, please get vaccinated. Niko hapa sijamea pembe, sijafanya anything, and I was vaccinated, so it's very true. Thank you for that. Please guys, if you can, get vaccinated. Turudi back to. Thank you for that, daktari. Okay. I think that should be our song.
Yes.
Ukipatana na mtu, have you been vaccinated?
That's the first thing you should ask. Can you put on a mask?
Si ati ukuwe vaccinated alafu ukae bila mask. You see kuna distance mimi na daktari. So please, daktari amesema ukweli. Thank you so much. That was a very good closing remark. Get vaccinated. So bye guys. Thank you so much for watching Cele's Reflection. See you next week on Cele's Reflection.